So this is the theme. Scarcely. The word scarcely is a very important word. It is a C2 vocabulary. Now, what do you mean by C2 vocabulary? It means extraordinary vocabulary. Only the specialists can use this word. Not everyone can use this word. So if you use this word in your OET writing and speaking, it will give you better marks. So take your notebooks, pencils, papers, eraser, sharpener, whatever you want, because we are going to list out number of things. So this is the topic. Variations in HIV testing. Variations in HIV testing. Variations. Variations means differences. Okay, differences, different types, classes, varieties. Variations means varieties. Variations means varieties. So this is the topic which we are going to do today. Right. So, reading part B. Reading part B. So, question number 25. So, let us consider this one as 601. 0601. Reading part B, 601. R means reading, B means, okay, part B, 601. Fine. So, this is question number 25. Yeah. So 25. It's a 1 part B, 1, 2. Okay. You can consider it as 1. Part B, 1. Okay. Is already done? Okay. So just let us revise this. Okay, it's already there. That is already there. So you can see this one. This is the question. This is the question, part B. 15th August 2022. Yes. Now go through this question and we are going to discuss. So there are two people, Aparna and Sophie. So I'll give you turns to discuss these things. So you go through this question, study your question, underline whatever you feel comfortable. So think about this 2 minutes. Yes. Now, so you can check with the answers now. Now, what you can do is 15th August. 15th August. 15 August 2022. Yeah. So here it is. Okay. All right. Now here, What is the right answer? So first one will be for Aparna. Aparna, yeah, all of you submit your answer. All of you can submit your answer. Question 25. Question 25. Yeah, submit your answer, A, B, C, D there in the chat box. Answer, submit your answer here. Submit your answer here. If it is A or B or C, submit your answer here because we are going to discuss now. Yeah. Nobody gave the answer. Why? Yeah, take your time. Take your time. Yes, submit your answer. Take 2 minutes and submit the answer. Yeah. Yes. So Sophie Dyson, type here only in the chat box. Okay, type here only. So Aparna says B, Jansi says C, Anjana says C. Okay. And Sophie Dyson says A. Okay. Now let us see this answer. Let us see this answer, how it is going first. Okay. Right. So now let me show you the answer here. Okay, you can send this link to your friends and you can ask them to join. So the answer is B. The answer is B. Inconsistent response to findings. Inconsistent response to findings. Okay, so that's it. So is this from the official book? Let us check. So official book. So 120. Okay, so it is B, inconsistent responses to new findings. The first answer is B. Okay, the first answer is B, inconsistent response to new findings. So now let us see how this answer is going to be right. View and master, notes master. Yes. Right. This is the question. So question number 25. Print screen. Yeah. So this is the question. And the answer for this, create poll. So A, B, and C. Logical reasoning approach. Logical reasoning approach. Yeah. So the answer is here. First one is B. Yeah. First one is B. You can go and click on one of the bubbles. You can click on one of the bubbles. Okay. You can click on one of the bubbles. How can you click on copy post link? I'm posting here. Okay, if you click on this one, it will take you directly there. So like that. And then you can go there and click on one of the answers. So that's it. So intravenous fluids inconsistent. So intravenous fluids inconsistent. So this is the question for us. Next. So let us see how they match. Let us see how they're going to match here. I'm going to show you the explanation now. So the changes in standards as per the revised protocol was necessitated due to Okay. Right. 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 Um, Due to means write down because, reason, cause, factor, all this. Due to is a cause and effect. This is a cause and effect. So due to means because of a particular reason. So before word is the effect and this is cause and effect. So this is the cause due to some cause. So there are three possible causes and one is the main cause. Now you can see here more evidence of associated risks seen. Risks is talking about the risks. Okay, and more evidence. Okay. Right, risks. Inconsistent responses to new findings. Okay, this is responses. Responses. Protocols that prioritize pediatricians only. So protocols. So here there are two things. Evidence of risks and inconsistent responses and protocols that prioritize only pediatricians. So now let us see very carefully here. Okay. So what you have to do is see here inconsistencies. Okay. Inconsistent. Led means result. Result means cause and effect. This is effect. Led to. Okay. Led to result. So cause leading to result. This is the cause which have led to the result. So here, individual or facility-based responses to the challenging literature. To the challenging literature. Challenging literature means new findings. Along with the interim recommendations of a national expert group convened under the auspices of Children's Healthcare Australasia, have led to variable practices across NSW health hospitals with consequent inconsistencies and risks. So you can see there very clearly. So responses led. So this is due to responses. Okay, this is the cause. Okay, and this led to the protocol result. Okay, this led to the protocol, that is the result. Okay, and you can see very clearly there, necessitated due to means because of. Okay, because of something, have led to, this is the reverse. Leading to means resulted in, result means effect. So effect, led means led to the effect. What led to the effect? Responses. These responses led to inconsistencies. Okay, so you can understand how it is mentioned there. So cause and effect. Responses are the causes. Responses are the causes. And result is variable practices. Various practices means revised protocol. Revised, changed. Variable means modified. Changed. Changed means revised. Okay. Right. Standards. Standards means protocol. Okay. So here, individual or facility-based responses to the changing literature along with the interim recommendations of a national expert group convened at the auspices of Children's Healthcare Australasia, CHA, have led to variable practices across NSW health hospitals with consequent inconsistencies and risks. So you can try to understand there. So inconsistencies. So now you can understand that very clearly there. Okay. Variable practices means modified, that is revised. Okay. Revised, changed. I hope you understand what I have told you now. Okay. So responses leading to variable practices. So responses, okay, due to these responses, okay, due to these responses, okay, revised protocol was necessitated. So resulted, due to means because of. What do you mean by due to and because of? Try to understand. Something, okay, he failed due to his carelessness. He failed due to his carelessness. Failed is the result, carelessness is the cause. Now reverse the order. Carelessness led to failure. Carelessness led to failure. Now you understand, try to understand what I am telling you actually. This is cause and effect. Okay. In here, this is led to is showing effect. Led to means effect. Led to effect, this one. And here it is telling due to. Due to means cause. Due to will point out the cause and lead to will point out the effect. Cause leading to effect. Okay, effect due to cause. Now see here. This is, okay, cause leading to effect. Cause leading to effect. Now here it is reverse. Effect due to cause. It's just reversed. It is just reversed. Just reverse, nothing. There is nothing, no nonsense is there. So simple as that. And answer will always almost be in the middle of the sentence. I want your statement here now, because I don't know whether you understood or not. Maybe what I am talking is coconuts are coconuts for you. Coconuts means rubbish, nonsense. Okay. So do you find my explanation? Do you find there is no need of my, do you find the explanation reasonable? If it is yes, you say yes. If it is no, unreasonable, say no. Okay. If you do not understand the concept, if you say yes, then I will make you and I explain the concept. I'll explain the concept. So try to understand that. I want your points, okay? Yes, sir, or no, sir, or even if you say, I don't want to attend the session, sir, also no problem. But something should be written, no? Okay, what is the use of staying on the screen and doing nothing? At least write a comment, yes or no, or explain, sir, explain me further, sir, like that, something. Okay. So write down some points. Okay. Write down some points. I'm giving you 10 seconds. So only Aparna, Mahim, and Jansi. So they are responding actively. Okay. So others don't want to write anything. No problem. So now let me explain you. Yeah, now let me explain you. What is this concept? This is cause and effect concept. Sometimes reversal of cause and effect also will be there. It's the same thing. Cause and effect. I'm telling you, and every time I tell you the same point, I tell you in different angles. Now this is reversal of the conditions. This is reversal of the conditions. Today, you are a father or you are a mother and you are taking care of your children. Tomorrow, okay, your children, they'll take care of you. So condition reversed, that's all. Condition reversed. Print screen. Yeah. Cause and effect. Reversal. Cause and effect reversal. Okay. Right. Yeah. NV Jacob says, can you explain once again? Yeah, I'm very happy to tell like that. Okay. Now, the point is simple. The point is very simple. Okay. Okay. Cause, okay, effect due to cause. Effect due to cause. Try to understand what I'm showing you here. Then cause leading to effect. Now, what is the difference between these two things? What is the difference between these two things? It is one and the same. It is one and the same. It is one and the same. Now, effect due to cause. What is effect? Failure due to carelessness. So failure is the effect or the result. Okay, cause and effect. Okay, effect due to cause. So what is the effect? The result. Okay, result is failure in the exam. Many people failed in the exam. Why? Because they are careless, that's all. People fail in the exam because they are careless. They don't bother that much. So they don't take, so they have done the exam doesn't mean that, prepare and carelessness somewhere, if some mistakes happen because of three reasons. Mistakes happen because of three reasons. Carelessness, yes, I'm telling carelessness. That means you did not take proper care to pass in the examination. That's it. If you take care to pass in the examination, definitely you will pass. So the care was a little bit less. That's what I mean to say. If you are careful, you will not fail. No doubt. Somewhere some care is missing, something, you did something wrong somewhere, that's why you failed. Otherwise, okay, if you heat ice, it melts. If you heat water, if you boil water, it becomes steam. There is no way something goes wrong. That's it. 100 degrees centigrade, water is converted into water vapor. That's it. There is no excuse for that. Okay. So that is what I'm telling you. If you put proper ingredients, result must be there. Result is not there, that means something wrong is there. You did not, you were careless in selecting your teacher, or you're careless in selecting an institution, you're careless in preparation, or you're careless in booking the exam. Somewhere something carelessness have been passed into it, that's all. So failure due to carelessness, negligence, lack of preparation, any cause, any result. So lack of preparation leading to failure. Only the thing is reversed, that's all. The order is reversed, and here he is telling the effect due to, and there he is telling cause leading to. Due to means because of means why. Simple thing. Reversal of the story. So cause and effect, cause relationship. They're mutually, okay, interdependent. So this is called reversal procedure. So I am coining this one, reversal. Okay. So this is a very deadly, dangerous thing. Reversal. Reversal of the reversal presentation. Same thing in a different angle. Okay, same thing in a different angle. That is what we can tell. Yeah. So this is from effect to cause. This is cause to effect. Now let us see here very carefully. I'm going to show you the same thing. So just identify, this is what I'm telling you every time. Okay. Due to means because. The same word, how many words I told? Yeah, I want a partner now, somebody who can speak for me. Jansi is regular. So Jansi, I'm giving you. Hello, Jansi.
Hello, sir.
Yeah, I told the word due to means cause, correct?
Yes, yes, sir.
Do you remember the words? You have written them, right?
Yes, I remember.
Yeah, recall all the words. You have your notes in front of you. Recall. Due to. Okay, due to, because, cause, reason, factor, therefore,
Yes, sir.
result, okay,
Hence, yes, sir.
consequence. I gave you no cause and effect, synonyms for causes and synonyms for effect, right?
Yes, sir. Yes, sir. They are their cause factors. So hence, therefore, due to.
Okay, for effect, what are the cause and effect theory? Okay, due to we understood. Now cause and effect. For effect, what effect, result, consequence? Many words I gave, right?
In fact, result, consequences, aims, object. Yes, sir. There were many.
So here is another word that I am adding to that one. Led to means resulted in. Write down two more words there. Led to, resulted in. So now in this sentence you will find the answer. Led to means before cause will be there, led to a result. So there are two sides, two dimensional. two dimensional. Here is vertical dimension. Now I am going to show you here. Careful here. Due to upward and due to downward. Okay. So due to upward and due to downward. Now, result due to cause. Result due to cause. Result because of cause. So this is result. This is result R. This is result R. Okay. This is result R. Okay, there is it. Yeah. This is result. Okay. And this is cause. Right. This is cause. Now you can understand very clear. So I'm trying to do everything possible so that you can understand. So this is result due to a cause. So you can understand that very clearly. Result due to cause. The words, two words which you have to search for. This is called talent, your technique. Now this is vertical dimension. This is horizontal dimension. Now let us relate this one. This is right side and this is left side. Okay. Or above and down. This is above, led to, or before led to. Okay. And this is down. And this is up. And this is down. So causes leading to effects. Sorry, this is result, not reason, result. So we should have given this as effect. So cause and effect, that would be even better. So this is effect. Okay. And this is cause. Cause and effect. Cause and effect. So effect due to cause, result due to reason. So that's it. Now here it is the reverse angle. Down and this is up. I don't have much space, so I'm showing you. Okay, no problem. This, so okay, from here, let us go up. From here, let us go down. So like this. So here led to, cause leading to effect. Cause. So cause. Above will be cause. Above will be cause. And below will be effect. So cause leading to effect. Try to understand now. So these are the two relations same. So he has already given effect here. So you have to find the cause. Effect, cause, effect. Only the style is reversed. Now I'm pointing them out to you. Both sides will be one and the same. Now here you see due to. Okay. Now responses is the cause. See the cause is here above. So this above will go here down, cause, responses. Okay. And these responses, okay, you see there, right? Now try to understand. responses, inconsistent responses, inconsistent responses. Okay, fine. Next one here. The importance of appropriate, not this one. Individual or facility-based responses to the changing literature, along with intermediate recommendations of a national expert group convened under the auspices of children's healthcare have led to variable practices. Okay, variable practices. So try to understand this. So, right, standards. The changes in standards. Changes means revised. Changes in standard as per the revised protocol. We can see here, right? So, individual and facility-based response to the changing. Okay. Try to understand there. Changes. So this is how you have to match cause and effect. Okay, effect due to cause. This effect, this result is due to a reason. And here, this cause or reason is leading to this result, consequence. So remember the cause and effect relationship. It is reversal of the story. Just reversal of the story. No need to read this question anything. No need from top to bottom reading is nothing but meaningless. Okay. There is no need to read from top to bottom. Why are you reading? Just simply see this one and you'll get the answer. In this particular sentence only you'll get. Individual. So where led to is there only. That sentence only will be there. That's all. And this sentence will be almost always in the middle. See here. 1, 2, 3, 4, 5. 5 lines leave. And from the bottom 1, 2, 3, 4, 5 lines leave. Finished. Okay. So in the middle 5 lines. Total 15 lines are there, in the middle 5 lines. So try to understand that. Okay. So this is the reversal of cause and effect theory. So he's only confused you, that's all. So that is reversal. Okay. I've shown you. Then this screen also I'll give you there. So this is the reversal process. So how is the reversal means? In the question he'll give effect first, and effect is already given and you have to find the cause in the question. But in the passage, he will give cause leading to effect. So leading to is the word which is helping you because of due to. Due to means leading to, same, but reverse order. You have to understand the relationship, that's all. Nothing else. Understand the relationship. Identify. If you otherwise you'll break your head, you'll only waste your time. You'll only waste your time. So now the point. Yes, I want your comments. I explained once again, Anvi. Yeah. So how your question, you'll talk in speaking, na? How does that sound? Yeah. So is it perfect or nonsense? You can say whatever you want. It's perfect, sir. It's nonsense, sir. Okay. I don't understand any sense, sir. Whatever you want to write, you can write. I'm just giving you 10 seconds because we are moving to the next question. So, concept understood. If you understood the concept, say yes. If you did not understand the concept, say no, because we are moving further whatsoever. Yeah. So shall we move on? If you say, if you respond only, we can move forward. If you don't see anything important, then we'll put a full stop. Now, why should we? Why should go and break my head? Your one question is equal to 10 questions you are doing. So apply the same technique everywhere. Wherever you see due to, because of, why, reason, cause, effect, impact, All these things are there. You can just write down. So just I want your answer, yes or no. Hello, Sophie. Where is Sophie? Hello, Sophie. Sophie Dyson. Yeah, I want your comments like that. At least 5 students I need. Half of the students out of 9, 5. Then only we can move forward. Yeah, Sophie, is that clear?
Yes, sir.
Sophie, you had a big
Yes,
problem
sir.
in reading. You told, correct? You said I have a very
Yeah.
big problem in reading. Yes or no?
Yes, sir.
So can you find any difference? You might have studied with many teachers, many institutes. I don't want you to name the institutes or teachers, but this explanation, okay, how was that to you? I want to hear in your own words.
It's different from others.
Yeah, what difference you find?
In other institute told about the read the passage full and take the answer.
So if you read the passage full, maybe you will understand or maybe you will not understand, or you are wasting your time. But is this sufficient for you? If you go like this, is this sufficient for you if you apply the technique?
Yeah, it's sufficient, sir.
Okay, fine. Very good. Very good. So Sophie Dyson is a new student. She joined yesterday. And she suffered for reading and listening because nobody is explaining this reading. She requested me, sir, this is what I want. Can you please help me? And I gave her admission because I saw that she was very serious. Okay. Yeah, Neha is asking, sir, explain once again, but I'm not going to explain everything, just a glimpse she's asking. So now let us say due to, led to, these are synonymous. Okay. Effect due to cause. The upper one is effect due to cause. When due to is there, before result will be there, afterwards reason will be there. So effect and cause. So there are 4 possible causes and one cause you have to find out. One cause you have to find out. But here led to means cause leading to result. Result due to cause. Cause leading. So these 2 are the same. Okay, led to and due to. Okay, this is result due to, this is reversal. Question is reversal and the passage is direct. Okay, cause leading to effect. This is direct, but the question is reversed. So that's why little confusion. Okay, so cause will be before and this is responses are the causes. So responses are here. That's it. Okay, responses are here. That's it. So here this is effect due to a cause, and cause is going back. Okay, so here cause leading to effect, cause leading to effect. So cause leading to effect. So this is cause. So directly here responses. Okay, you are going to responses and there are inconsistencies. So you are matching like that. Fine, that's it. So next question. Next question. So this is the next question. 2 minutes, please. Okay, prepare. Study. Yes. So now question number 26. Okay. Question 26. Okay, question number 26. So second question. Okay. So you can submit your answer here. You can submit your answer here. What is the right answer? Submit your answer, please. Yes, only one answer so far. Okay, take your time, no problem. Study. Study. Answer. Submit the answer, please. Yes. Print screen. Yeah. So you can submit the answer, please. Mahin, only Mahin has submitted. Okay. Right. Question number 2. Question number 2. Okay, for the day. Right. Create poll. Okay, now let us. 3 people have given the answer. Yeah. So 2 more. I'm waiting for 2 more. At least half. Okay. So Pula Srilata, Sophie, and Janu. Very good. 4 students have given. Mahim, Srilata, Sophie, and Janu. Yeah. I have increased the number of sessions. Okay. So try to be available whatever time you are available. So 5 students. That's very good. Awesome. 5 students. Okay. Now let us check the answer. So question number 2. Question number 2, the answer is C. The answer is C. Yeah, the answer is C. So Uppula Srilata and Sophie Dyson. Okay, both of you are right. The answer is C. Okay, now let us see why C is right. Okay, quiz mode A, then B, then C. So this is logical reasoning approach. Logical reasoning approach. The answer is C. So that's it. So the second answer is C. Okay. And conservative estimates of procedural effectiveness. Conservative effectiveness of procedural estimates. Okay, now let us see that. Right. Okay. Right. The guidelines on CDCT aims to enumerate. Do you know what is the meaning of the word enumerate? Because this is very important. To enumerate. What is the meaning of this word? If anybody knows this meaning, try to break the word and find out the root word. Enumerate. No, Mahin, not find out. Enumerate. One word is there in that one, internal. Enumerate. Yeah. If anybody knows, right? Enumerate. Numerate means enumerate, elaborate. Not elaborate exactly. The word, what is the word there in enumerate? Find out. There is one word in this. enumerate. Enumerate. If you see this one, immediately you will recall a word. What is that word? Identify the word within the word. No. No. What is the word inside enumerate? I'm not asking the meaning. Find out the word which is there. This word is not the root word. No, not with example. Okay. Enumerate. Yes. Yeah. Count. Number. Number. Numeral. 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 Number. Okay. Enumerate means list. Make a list. Okay. Make a list. Okay. Now let us go to Cambridge Dictionary. Let's go to Cambridge Dictionary. And just check it out. Enumerate. There are many meanings for this one, but enumerate means what? Okay, to name things separately one by one. All the name means number. To make a list. Okay, list it out. Enumerate means enlist. Make a list. To name things separately one by one. Okay, enumerate the things you need. I want books, I want pens, I want tables. So names, you write the names, books, pens, tables. You make a list of it. Enumerate means listing out things, to name things separately one by one. Okay, that is what it is. Enumerated means made a list of all those things. Okay, arrange in an order. Okay, so label, classify. Okay, so all these things, short list. Okay, enumeration. Enumerate means that is a very powerful word. Numeral means number of things. All the things, make a list 1, 2, 3, make it a number, serial order like that one. That is enumerate. It's a very powerful word. It's a formal word. That's why you did not understand. Okay, so make a list of all the things. Okay, right. Now let us see. Enumerate means highlight, means focus, concentrate, pay attention to. Okay, underline, give stress, importance, like that. Now let us see here. Now, yes, the answer is C. Right. Now, how come answer is C? Anybody can explain here. Who has given the right answer? So, who has given the right answer? Let me check. Right answer given by Sophie and Uppula Srilata. Yeah, first Srilata, then Sophie. Yes, Srilata, can you explain why you thought C is the right answer? Next to you, Sophie. Yeah, Uppula Srilata, can you explain? Yeah, thank you.
Good morning, sir.
Good morning, Srilata. Can you explain?
Yes, sir. In the first, it is given in the first bullet that benefit screening with LDCT has shown substantially. I felt that it is an increased importance to reduce the risk of from cancer. So something which is traditionally increased.
Yes.
And also,
so, very good. You said, you gave a wonderful point. Your answer is right. You gave a wonderful point. I'm going to explain. Be online. Don't switch off. You have found it in the first point. Okay. You have found it in the first point. So, 2, 2. Okay, 2, 2. So, screening with LDCT. Screening with LDCT has been shown to substantially reduce the risk of dying from lung cancer. This is the first. Okay. Bullet points means list only. Number 1, number 2, number 3, number 4. So 4 points are there. 4 bullet points are there. This is the first point. So it is listed. Enumerate means enlisted. This is the list, first list of benefit. And this is the second, this is the third, and this is the fourth. What you have done is you have got from the first one. Yes, has been shown to substantially reduce. To enumerate, the guidelines of the CDCT aims to enumerate the dash. Okay. So this is reduce the risk of dying. This is effectiveness. Reduce the risk is effectiveness. Reduce the risk is effective. If it increases the risk, it is okay. Effectiveness. Okay. Reducing risk is nothing but effectiveness. It's becoming more effective. If it is not reducing the risk and the risk is increasing or remaining as it is, that means the more the reduction of risk, the higher the effectiveness of the procedure. So that's very simple as that. Okay. So reduce the risk, right? So it is very clearly showing reduce the risk of dying from cancer. Has been shown. This is the focus. I already told you, has been shown. Shown means demonstrated, means aim. This is the goal. What is the goal? Effectiveness is the goal. Effectiveness of the procedure is the goal. So that is what is the effective. Reduce the risk of dying from lung cancer. People, the number of deaths are reduced. So it is procedural effectiveness. That is what it is aimed to show that one. Is that clear? That is what you wanted to say, right?
Yeah, yes, sir.
Is that clear? You are not able to explain, but I explained. Do you agree with what I have explained? Is it the same or anything different? Still, you have to add. Tell me.
Clear, sir. I mean, I was not able to give the synonym for that. Effectiveness, which has given a striking point is to reduce the risk. This is, as you said, is the enumerate the benefit which has been given.
Very good. That's fine. Okay. Next. That's very good. Excellent. Next one, Sophie. Sophie. Yeah. Can you give your explanation why you think C is the right answer? Hello, Sophie. Can you explain why you think C is the right answer? Can you unmute, please? Yeah,
Good
Sophie.
morning, sir.
Yeah. Yeah. Tell me why you think C is the right answer.
In the third bullet point,
In the third bullet point, yes. Tell me.
findings related.
Finding
More than in 1,000 patients with the false positive result.
1 in 1,000 patients with a false positive result experiences a major complication,
Major
right?
complication.
Yeah. Okay. So this is what it is showing. Okay. So according to Sophie, Sophie has got into third point. Very good. Okay. Sophie has got into third point, right? You can get answer anywhere because all these are list. Enumeration. Enumeration means making a list. First one is benefit, second one is limitation, third one is harm, fourth one is okay. This is so 4 points. First list of the first thing. Enumerate means make a list. Benefit. This also will give the answer. Limitations. This also will give the answer. Harms. This also will give the answer. Individuals you well. This also will give that. Any answer you will give you the answer. That's all. Anyone, any point will give because it's a list. Why is he making a list to do what? Okay. So now this also will talk about procedural effectiveness. Now let us see here. Yes, Sophie. She's telling finding non-lung related incidental finding. Less than 1 in 1,000 patients with a false positive result experiences a major complication resulting from the diagnostic workup. Death within 60 days of a diagnostic evaluation has been documented, but is rare and most often occurs in patients with lung cancer. So you can see that one. Okay. Estimates, number, list, making a list. Okay. For making a list of things. So this is harm occurring to the people. Yeah. And that is less than 1 in 1,000 patients. Less than 1 in 1,000 patients. You can see that one. Okay. And death within 60 days of diagnostic evaluation has been documented, but is rare and most often occurs in patients with lung cancer. So try to understand that one very clearly. All right. So the point what you have to find out here is lung cancer or some non-lung related incidental finding. So that is the comparison here. There is a significant chance of a false positive result. There is a significant chance of a false positive result. That means positive results are not there, but chance is there. Okay, significant chance is there for a false positive result. Try to understand. That is the harm. Okay, which will require additional periodic testing. Okay, and in some instances, an invasive procedure to determine whether or not an abnormality is lung cancer or some non-lung related incidental finding. And this is related to lung cancer, not non-lung related incidental finding. So that's you can see there in the last sentence. Okay, so less than 1 in 1,000 patients. That means it's very effective. Less than 1 in 1,000 patients with a false positive result. Okay, it's by mistake it is shown as positive result. Otherwise it is negative. You can see false positive result. So that is also 1 in 1,000. Okay, only 1 in 1,000. Less than 1 in 1,000. Less than 1 in 1,000 means it is very effective. Okay, wrong things are very, very minute. Less than 1. Not even 1%. It is 0.1%. 0.1% is the chance of false positive result. Okay, so that means it shows that the very effective, less than 0.1. Yes, less than 0.1 means 0.01. That is the level of effectiveness. That's the level of effectiveness, and that also is false positive, not really positive. It's false positive result. Okay, right, and that also is not from is regarding lung cancer, not this one. Okay, that also is regarding lung cancer, not non-lung related incidental finding. So you can see there. Okay, so harm is very minute. Harm is very minute, less than 1 in 1,000. That even that is also by mistake. Otherwise, that also will not be there. So that is what he's telling. So it shows that it is less than 1 in 1,000 means very. For example, 10 out of 100 means too much. Okay, 10 out of 100 means too much. That is very high. Means 100 out of 1,000. So that's the difference. Okay. Yes, Mahin. Yeah, you can ask. Mahin, unmute.
Yes, sir. So, what is the meaning of conservative estimates?
Conservative means traditional. Conservative means traditional. Okay.
Conservative estimate.
Conservative estimations means calculation. Estimate, no, this is an estimate. 1 in 1,000 means this is an estimate.
Yes, sir.
Okay. Conservative means the standard. Okay, traditional standard. Okay. This is standard. Let's say
okay, sir.
This is a standard. Okay. Everything is there very clear. 1 in 1,000 is an estimation, roughly estimation. Less than 1%, 1 in 1,000. That means 0.01%. That's an estimate. You are giving a value. Estimation means value. You understand? Okay. Any doubts? So like this, you can find the answer. So this also shows, because all the points enumerate means make a list of. So all the lists, okay, aim to enumerate something only, the result, the effectiveness. Okay, the effectiveness, yes. Print a screen. So second point also will be giving the answer. Fourth point also will be giving the same answer. So okay, this is according to the third point. Second point also will give the same limitations. LDCT will not detect all lung cancers. So LDCT will not detect all lung cancers or all lung cancers early, and not all patients who have a lung cancer detected will avoid death from lung cancer. See that one very clearly. So it is talking about the effectiveness. Okay. LDCT will not detect all lung cancers or all lung cancers early, and not all patients, means there are some chances, okay, right, which it will not detect. Most of them it will detect. Most of the lung cancers it will detect, and most of the lung cancers it will detect early, and most of the patients who have a lung cancer detected by LDCT, okay, will avoid death. But there are some chances. There are some chances, limitations. Some cannot be detected. Some lung cancers cannot be. LDCT will not detect all lung cancers. That means there are some lung cancers which cannot be detected by LDCT. Number one, all lung cancers cannot be detected early. All the patients who have lung cancer detected by LDCT will, some of them may die. Some of them may die from lung cancer. So that's it, some of them. So this is the effectiveness. Okay, how much effective it is? How much effective? Yeah, it's not 100% effective. It is not 100% effective. It may be 98% or 97% or 95% or maybe 90% it is effective. That is effectiveness of the procedure. Okay, so you can see here. Not all, means in some situations it is ineffective. Okay, estimates of not all means some. Okay, not all, 95% and above, 98%. So some lung cancers cannot be detected. Some lung cancers cannot be detected early, and the patients who they have detected, they cannot avoid death. That also is possible. So that's it. And next one, the individuals who have value to the opportunity to reduce their risk of dying from lung cancer and who are willing to accept the risk and costs associated with having an health, and the relatively high likelihood of the need for further tests, even tests that have the rare but a real risk of complications and death, may opt to be screened with LDCT every year. See this one. Opportunity to reduce their risk of dying. Okay, who value the opportunity to reduce their risk of dying from lung cancer and who are willing to accept the risks. They can go forward and accept this one, and they can have LDCT every year. Okay, so that is what it is. And they should also go for other tests also, not only LDCT, they should go for other tests also, because you cannot take this as 100% guaranteed. So there are chances. So that is estimation. Okay, not 100%. Okay, they want to value the opportunity to reduce their risk. Reduce the risk, chances are there. So you go for that one. That is what he's telling. So all the points are pointing out here only. And key discussion points for the process of shared decision making related to screening for early lung cancer detection with low dose helical computed tomography. Okay, low dose. Okay, lung cancer detection with low dose helical computed tomography. CD, cancer detection computed tomography. That's it. So all these things, these are the points, bullet points. Bullet points means making a list. So that is enumerate means make a list. So all the lists are related to that one only. Okay, right. Next, number 3. Okay, point number 3. There you are. Yeah, you have 2 minutes. You have 2 minutes. Yes. So, question number 3. Question 3. Submit your answer here. Yes. Submit your answer, please. So 6 students have given the answer. Very good. Good participation. Wonderful. So now let us check the answer. So the choice of answers are, okay, C, B, A, C, A, C. So 3 C's, 2 A's and 1 B. Okay, now let us check the answer. And the lucky winner is, let us see, A. The lucky winner is A. Okay, so 2 people have given the answer A. That is Sophie and Neha Banu. So 3 people, okay. So 2 people, Sophie and Shahid. Sophie and Shahid, okay. Third answer, that is A. Right. So A is the right answer. So let me feed the answer here. So create poll. Quiz mode A, B, C. Right. Logical reasoning approach. So the answer is A. So that's it. Now let's go to the question once again. And now two people, Sophie and Shahid. Okay, Shahid. Okay, Sophie and Shahid. So Sophie. Yes, Sophie. Can you explain why you thought that A is the right answer? Can you explain me? I don't know. So you explain me. For example, I'm a friend of yours and I don't know. So you are going to help me. Like that, you think you become a teacher now and explain why you felt A is the right answer.
The part in the first sentence, participation of a student to the performance of variable services must be performed in the physical presence of teaching.
Okay. Right. The evaluation and management documentation. The evaluation and management exercise. Exercise is nothing but documentation. Very good. First sentence only you got the answer. Very good. Okay. Now here, students may document services in the medical record. However, the teaching physician must verify. Okay. However, the teaching physician must verify. So, okay. So, he may document, but the teaching, okay, billings. So, physician is very important. The teaching physician is very important. Yeah. So, your point, I'm analyzing your point now. You're saying like this. Okay. Right. So, evaluation, management, documentation is an exercise. Okay. Requires it. Okay. Okay, requires. Okay. Requires means must be performed. Requires means must be performed. Requires means must. Okay, requires means must. Okay, be performed. Performed. Performed is going here. Perform. Okay, in the presence. In the presence of a physician. Physician is there, but billing is not there here. Okay, billable service is billing. Okay, so you can see there, all the points are here. Document service, yeah, document services accorded in the medical. Students to document service, yeah, he can document. Students may, not must. May means not required. May means 50-50. Requires means must. He requires means must. May, document service is correct. Document service in the medical record is correct only. But however, billing physician, the teaching physician, again it is going to A. Okay, B is also correct, but it is partially correct because it is may. There is a lot of difference between must and may. You should understand. These are called modal relationships. Okay. I'm going to show you something very important here. Modals, the relation of the modals. This is saying may and this is saying must. I think you understand the difference between may and must. Requires means required. Dash is required. He requires 1,000 rupees or he requires 350 marks. That means must. You require B grade means it's a must. You require at least C+ in writing. Okay, but require B in all. be involved. The students who are going for the OET, the students who are going for the OET, occupational English test, they require B. B means, that means they may need or they must need. They must get or they may get, which is the point here. So this is the importance, okay? This is the importance of modals. Modals transform the level. May document means, okay, they can document. However is the twister. However, they may document. Some may document, some may not be documented. That's not a problem. Okay. So here, however, they may document. However means but. This is a twister, means that is not accepted unless and until the verification of the physician, verified by in the medical record. The teaching physician must verify. Must verify. See, must is important. Must means required. What is required? Medical record must be verified by the physician. This is a must. This is not possible now. This is not possible. This must is not possible. Must means required. So this is not there here. Physician is not there here. So this answer is ruled out. Okay, this answer is ruled out. Record significant decision-making exercises involved. Yeah, they can record. Okay, the teaching physician must personally perform or re-perform the physical exam and medical decision-making of activities. Must. See this must. Okay. So the students cannot record. Students, the teaching physician must personally perform. See here. This is also there. This is also correct. But it, okay. If you see, this is also correct. It must be recorded decision-making exercises. But who must record? Teaching physician, not the students. Teaching physician, not the students. Must. See this must. 3 places must. 3 places. It's a must. Must. Who is a must? Again, physician is a must. So everywhere it is pointing to the physician. So physician is there in A. Now let us see. Where is this? Yeah. Now let us see. Here, students in the presence of physician. Here only students, no physician. Here record significant students, no physician. So here physician plus student. Here only student. Here only student. But here physician must be performed in the presence of a teaching physician. Physician is a must. Physician is a must. Physician is a must. So everywhere physician is a must. Only physician is only here. For that one, why reading all this nonsense? Huh? Requires means compulsion. Write down the synonyms of requires. Require, need, necessary. Write down the synonyms. Require, need, necessary, mandatory, compulsory. This is another type of word which means, okay, obligation. Write down the word. These are the words related to obligation. Obligatory demand. Obligation based questions. Obligation based question means yes or no. That's all. Yes or no. That's all. For example, if I ask you a question, can a nurse teach English? Can a doctor teach English? Yeah, they can teach English. They may teach English, but it can be only confirmed by a language professional, whether what he's teaching is right or wrong. Otherwise, whatever they teach, that is going on, because you don't know, he doesn't know. Finished. So doctor is meant to teach. Doctor is meant to do patient's treatment. Nurse is meant to assist the doctor and help the patients. They are not professional teachers. They are professional nurses and professional doctors. Doctors can teach. Doctors may teach. Doctors may teach. But the authenticity of the teaching must be confirmed by a language professional, because teacher is a certified professional. So that's what I'm saying. So obligation. Who should teach and who may teach? Anybody may teach. Anybody can teach. That is what is happening. Okay. So now here we have one girl in our group. Okay, she has written 4 times. There is one more person who has written 8 times. I don't remember who is that candidate. Okay, yeah, 8 times they have written, 8 times. So nobody helped me in reading. How can they help you in reading when they themselves don't know? That's the problem, no? So obligation or not, compulsory or not, write down the synonyms. Yeah, Jansi, I want you to note down all the points. Neha, Jansi, Uppula. So these are the regular students who follow. So write these points. Requires, requirement, need, necessity, necessary, obligation, obligatory, mandate, compulsory. Okay, then next, that is what is must, must and should, must and should. These are the modals. May is not compulsory. You may do it. You must do it. If I say you must attend the class, then you must attend. If you say you may attend, means that is your wish. It is not compulsory. That's the meaning. Okay, that is the meaning. Okay, now 1 second. Yeah. Explanation is given there. Okay. Now I am giving you 10 seconds. Write down how this is called obligation based questions. The earlier one was cause and effect based questions. This is second one, that is obligation based questions. So second point is obligation based questions. Obligation based questions. Must or not must? Obligation based questions. Yeah. Okay. Do you think that what I have given you the explanation is sounds good or not? So what grade you can give for this question? 0 to 10. Okay, you think, and give the reason also, not just writing 1, 2, 3, 4, 5, 6, 7. Give a reason also why you think this explanation is good. You have to tell me. Yes, 4 people have given the comments. So just to give your comments. Okay, so if it is beneficial for you, okay, I'll give more. So then the number of comments are there, more sessions I'll be giving you. It's not I need these things, so that I think that they are benefit for you, no? So I feel only one Neha Banu and Jansi and Mahin benefit only for these people. So why I should give more points to everyone? So why I should spend more time like that I feel. So I want your comments and feedbacks, how these are benefiting you, so that I can give more explanations. Okay, that's what I want, not for my sake, for your sake only, so that I can give more points. So just write 1 or 2 sentences. So how they are benefit. See, for example, this depth we are discussing. So these questions in the other points you can ask. These are requires the word. It will help you. That is the only word which is going to help you here. That is evaluation, management, exercise, students, everything is common. Only requires is the special word. So that is the operating word. That is the key word. So finding out operating words. So now at least 50%. The next one. So next question is 28th question, 2 minutes. Yeah. Next question. Every time I explain, I'll give new points. I don't teach the same thing again. So because there are many ways of finding the answer. It's not only one way. There are many ways of finding an answer. If you miss one, you will get another way. Okay. Right. Yes. Okay. So 6 students have given the answer. Yes. So now, so fourth question this is now. Fourth question. Very good. So print screen. Okay. So question number 4. Question number 4. So question number 4. Now many students have given the answer. Let me check. Oh my goodness, one-sided. B, 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 B. 5 answers. B. Okay. What about the rest? Okay. What about the rest? So fourth question is, now let us check the answer here. So abracadabra. So the answer is B. Absolutely right. Fourth answer is B. Fourth answer is B. Create poll. So quiz mode A, B, C. Logical reasoning approach. Logical reasoning approach. The answer is B. Fourth B, yeah. So fine. So this is the fourth answer. You have to find out. You have to find out. So Shahid and no new students. Okay, only Shahid. Okay, right. So all of you gave the answer. Now I'll give the chance to speak. Yeah. So who gave the first answer? The first answer is given by Shahid. Shahid Afridi. Hello, Shahid.
Hello, Assalamu alaikum.
Walaikum assalam. Kaif al-hal?
I'm good, alhamdulillah. Thank you very much.
Where are you from? Can you introduce yourself? What is your profession?
Actually, I'm a doctor. I'm from Pakistan. I'm currently living in Gulf.
Oh, very good, very good. Okay, that's very fine. Welcome to the channel. I appreciate your patience. I appreciate your patience. Many people don't have patience and time. Time is very precious. Many people don't have time to dig diamonds. Okay, so they enjoy with stones. Correct?
Yes, correct. You're right.
So diamonds need time, right? They don't have time. So for them, time is more important. Diamonds are not important. Forget them. We are not bothered about them. So you are trying to dig some diamonds. Now, Dr. Shahid Afridi. Okay. You know, Shahid Afridi is my favorite. Okay.
Thank you very much.
Okay, fine. So now I want to ask you, why are you spending so much time here? What is the benefit you are getting?
The benefit is that the reasoning that you guys, especially you, are telling about the synonyms and how we can focus on the specific finding in a particular question. Like last time you told me obligatory, must, may, the difference. I think this is the best approach.
Okay. So what I'm going to do is, I think you are the right person. I'm going to give you a link. Okay. This is my WhatsApp link. I will add you in the doctor's group because I don't think you are in my WhatsApp group. So I'll add you. Yeah, I'll send you one doctor's group. Afterwards, you send me a message and I'll add you in the doctor's group. Write your name there, Shahid, and I'll add you in the doctor's group and I'll make you the admin. You can add your friends, doctors, all doctors, only doctor's group. Okay.
Inshallah,
only
sure.
Doctor's group I'll give you. So that's fine. WhatsApp.me. I'm going to this October, I'm going to generate a group which is very effective. I'm going to remove the non-active students and make them a good group, okay, where everyone will be participating very actively. So you can join there. Yeah, this is my WhatsApp. All of you, new students also. Yeah, here it is. No need this one. Okay, so this is my link, copy link. So new students, if anybody is there, you can. Okay, for regular classes, there are chances. Okay, for nurses, it is 3,000 per month, and doctors, it is 6,000 per month. So for regular sessions, those who are attending, and you can send a WhatsApp there. I'll add you in my free group. So if you are interested afterwards, you can think, but now it is open. So fourth one is B. Fourth one is B. Where is this? Yeah, fourth one is B. Yeah, here we are. Then the explanation. If we go to the explanation now, so Shahid will be explaining why this option is right. So you are the first answer. Yeah, Shahid, you are the first to answer, so I'm giving you the first chance.
Yeah. When I go for the question, it is written that it is important too. That is something is what is called as a conclusion of this paragraph. Okay, in the first paragraph they write that non-judgmental approach and judgmental approach. Then they write that in the second they write focus question and they give some example. Okay, so if we read all the question, all these 4 or 5 lines of this paragraph, they told us that we need to take the patient history and we should not ignore the patient symptoms and we should not jump to the diagnosis at once. So if we keep these points in our mind and we go for the option of the answers, so convey the gist of the problem. So it is not written anywhere that we can give a glimpse of the problem. And third option, focus on the associated illness. They told, contrarily, they told inside the this paragraph that we should not jump towards depression, anxiety so quickly. So only one thing is pertinent to this question and to this paragraph: articulate the symptom with this patient, that correlate the symptoms of the patient before making a diagnosis. That's why B is the option.
Okay. Yeah. Fine. That's very good. Next point. Next one is who is the next one? Next one is Sophie. Yeah, Sophie. Sophie, can you give me your reason why you gave B as the right answer?
In this paragraph, or mainly focus on the symptoms. That's why I choose B.
Yeah, this paragraph is focusing mainly on the symptoms. So that is the reason why you said symptoms. Okay, fine. Right. Next one. Upula Srilata is the third one to respond. Srilata. Hello, Srilata.
Hello, sir.
Yeah, how are you?
Good, sir. Sir, in terms of my answer, in the fourth paragraph, it is showing that avoid diagnostic labels at too early a stage. Instead, focus on the discussion around the patient symptoms and experience.
Okay, very good. Patient symptoms, very good. Okay, very good. Fourth point. So 1, 2, 3, 4. So B2, remember hostility can be a symptom of the illness. Remember means important. Okay, fine. Remember means very important thing. Don't forget. Don't forget means important, correct? Very good. Very good. Everyone can give different points. That is what I'm telling you. So that's why when you talk to others, you will know how they are getting the answers. That's why I changed the style. Okay, I changed the style. So the next one is after Upula Srilata, Mahin. Hello, Mahin. Mahin. Yes, unmute Mahin.
Yes, sir.
Yeah, this is the girl, Mahin, the pharmacist from Pakistan. She made a big group. So I really appreciate her interest. And anytime I give session, she comes and joins. Okay, Mahin, tell me why you think B is the right answer.
Sir, overall, the paragraph is suggesting on the symptoms of the patients, like ask and focus question if suspected these symptoms, like this the depression, anxiety, second bullet point, and also the second last bullet point, avoid direct diagnostic label. So both these points are pointing towards the option B.
Okay, very good. Very good. That's also true. That's also, that angle also is right. What you said is also right. Next one. Who is the next to answer? Neha Bano. Yeah. Last one is Neha Bano. Yeah, Neha. Yeah, tell me what is the reason for you to give this option?
Hello, sir.
Yeah, Neha.
Sir, I saw here in the question on suspecting a disorder, and in the second bullet point, ask focus question if psychosis is suspected. So do not too readily dismiss symptoms. So by seeing this bullet point, I have chosen this B option. And also in the down second bullet point, avoid diagnostic labels at too early a stage, instead focus on discussion. So by seeing these two bullet points, I have selected this B.
Yes, that's fine. Absolutely fine. Because it's very good in the way how you are saying. Do not dismiss symptoms. Don't take them lightly. Take it serious. Focus, because they are important. Symptoms are important. Do not readily dismiss symptoms, because they're, if they're not important, you can discard. Okay, you can readily dismiss them if they are not important, but it is important. That's why he's saying do not dismiss, because it is important. So every sentence tells that one. Only you have to read between the lines to understand this one. Otherwise, answer is everywhere. In every line, answer is there. Every bullet point, answer is there. Okay, that's what is the speciality of B. Okay. So now let me explain. Let me explain. I'll give you a different dimension. I don't know whether you understood what is the most important word here is important. Important means must. Important. It is important to attend the classes regularly. That means do not, too readily dismiss your classes. Do not too readily dismiss the point that it is important. It is important. Don't dismiss that one. Don't take it lightly. That is the meaning. Okay. So it is important. Important means you have to give importance. This is related to the previous question. This is related to the previous question. Requires. Requires means must. Important also means must. Requirement, important. If it is important, that means it is a must. It is required. It is required not to dismiss symptoms. It is important not to dismiss symptoms. It is important not to dismiss symptoms, because symptoms are important. Don't dismiss them. Important means you must give them importance. Symptoms are to be given importance. See there. Okay. Yes. Mute. Somebody's mic is open. Mute it, please. So now symptoms. Important. Do not dismiss symptoms. Symptoms are important. That is why do not dismiss. They should be taken seriously. They should be taken. They are very important. Do not dismiss. See here, do not dismiss symptoms because they are important. The answer is there itself. Okay. So do not dismiss because, yeah, symptoms. If you dismiss symptoms, that means it is unimportant, but he's telling not dismiss means important. Dismiss means unimportant. Not dismiss means important. See, try to understand the relation. Read between the lines. You are not supposed to dismiss symptoms. Not dismiss. This is it. Not dismiss means it is important. Why not to dismiss symptoms? Because they are important. So symptoms are important. Do not dismiss. Answer is there. Answer is there. Here. Answer is here. One second. Yeah. So, dismiss, not a dismiss. Okay, not a dismiss. And the word symptoms. Do not dismiss because it is important. So, there is a relation here. Important, so not dismiss. Important, therefore don't dismiss. That's it. What are important? Symptoms. Okay, symptoms. Ask focused questions. Ask questions. That means asking questions means you are articulating. Articulating means you are talking. Articulating means talking. If you don't know the meaning of articulate, it will be a problem for you. Articulation. Okay, articulation means talking. Like negotiate, discuss. Ask questions means discuss. Inquire, question, ask. Okay. So you're asking questions. That means you are articulating questions. Okay. Psychosis is suspected. Psychosis. Psychosis is a disorder. Suspected is here. Unsuspecting. Psychosis. Ask questions means articulate. Symptoms. Ask questions. Okay. Regarding symptoms. Okay. To whom you have to ask? The person who has a psychosis. That means patient. Psychology. Psychiatry related. Psychosis is psychiatry related patient. Psychosis there itself is a patient. Psychosis, you say, if a person has psychiatric problems, it's a disorder, mental disorder. So every word is there. Okay. Ask the patient who has psychosis, the disorder, mental disorder. If you are suspecting, is suspected, it is important, means do not discard because it is important. If something is important, don't throw, means it is important. Throw it off means unimportant. Don't you understand that? Okay, some people ask questions. Okay, some people tell something. Children say, I want this, I want this, I want this. You quietly dismiss them because you think that they are not important. Okay, if your son asks something and you say, yeah, okay, that's very good, we'll buy it, then that means it is important. Don't you understand the read between the lines? Read between the lines. This is point number 2. I'll give you multiple options, okay? I'll give you multiple options. One option is easy, but multiple options, if you know, maybe one option you may not get in 2, then what you will do? Okay. So if you don't get the answer in point number 2, bullet point number 2, then where will you find the answer? I'm going to show you multiple answers. Don't think that this is the only answer. Okay. You are one person, so you can find answer in one place. Okay. Then this is one person showed me. Then second, many people showed many different answers. I'm showing you all are right. All are right. Answer is found everywhere. So next, second option. Now let us see the second option here. Non-judgmental approach. Non-judgmental approach. Non-judgmental means you are the deciding person. You are not discussing, you are the authority here. Non-judgmental approach. That means adopt a non-judgmental approach. That means you don't give judgment. No, because of this. No. You have to negotiate. This is judgmental, is one-sided. Judgmental, that means like a judge, you are giving a decision, no other, nothing else. Once you give a judgment, that is final, finished. There is no other discussion. That's final one. There is no negotiation. There is no argument or disagreement or agreement. Nothing is there. That's final. So non-judgmental, don't give final Think all the other things also. Give him a chance to speak. So conveying the gist of the problem is judgmental. One way. So you are telling what is the problem to the patient. That's it. Your opinion, your viewpoint, your ideology, you are giving him. That's all. This is one-sided. It is judgmental. It is judgmental. Okay. It is judgmental. Now, adapt a non-judgmental approach through what is said and not said. What he told, what he did not tell. That means you are involving the patient also. Don't just tell your opinion. Consider what he said and what is not said. He may not tell also some things. He doesn't want to reveal those things. So you can discuss with him. Okay. And then you have to consider what he said and what he did not say. Then don't judge his points. Based on what he is telling, adopt a non-judgmental approach. That means you have to articulate, you have to discuss, you have to negotiate. Okay, what more, what else? Okay, that may be the problem. Yeah, your concerns are reasonable. Maybe it is right what you are saying. Maybe chances are there. Don't blindly say, no, that is not the problem. The actual thing is this one. Don't give like that one. Discuss with him. Articulate. Articulate. So listen and understand. In the first one, A, convey the gist of the problem. There is no listening and understanding here. But here, articulate the symptoms with the patient. That means you are listening what is the symptoms told by him and what are the symptoms observed by you. Listen. Listen to the patient when he's telling about the symptoms. You are articulating, you're talking, you're discussing, you're negotiating, you're agreeing and disagreeing with him. All these things are there. So with the patient is included here. Here patient is not there. Here only doctor is there. Here patient is included. In this discussion, in the first A discussion, patient is not included. You are just passing on the information. Convey. Convey means pass on the information. Do you know convey means pass on the information? Convey means pass on the information. If you don't know the meanings of the words, it is very difficult. So convey the gist. That means you are not listening. You are just passing on the information, what you think the problem is. According to your knowledge, you are just telling him. That's all. You are not listening to him. You are not understanding the patient's version of reality. You just see and you're just telling something about the problem. That's all. You don't want to listen to the patient's version of reality. It may be bizarre. Sorry. Okay. Yeah. It may be bizarre. His concerns may be unreasonable also. Sometimes they are reasonable. But he thinks it is, no. I don't want these things because I am worried about this. I have tension. Okay, this many years I have taken, but I don't want. Something he will talk. Maybe he'll talk nonsense also. It may appear in order to discover more about what is going on in their world. It's his personal experience. What is he experienced? Learn more about him. If you ask questions, you can get it. This is called elicitation, gathering information from the patient. Ask questions. That means elicitation. The word is called elicitation. You are articulating and you are finding out his symptoms, what he is thinking about it. So, what is going on in their world? If you don't ask him, if you don't discuss with him, if you don't negotiate with him, if you don't discuss with him, you will not able to discover anything. And this is without discovering anything, you are just giving your opinion. The doctor is giving the opinion to the patient. That's all. So first one is one way. The second one is two way. Articulate means I will listen what you are telling, then afterwards I will tell what I am thinking. Okay, I will not just outright say no. See, now what I am doing, everyone's points I have listened, then I am explaining why it is right and why it is wrong. So first you have to listen. Because I am an English language doctor, I am teaching in this style. Okay, your problems I am discussing. The next one. So that is articulation means what? Two way. Convey means one way. Focus on associated illness outcomes. Focus on. That means you are focusing. Here also patient is not there. Here also patient is not there. A, patient is not there. C, patient is not there. So A is ruled out, C is ruled out. Because important thing is the patient is important. Patient is important. Okay, because patient only can tell about the symptoms which is facing. You can find only some symptoms, but he has been observing many days. So he is the best person to tell about symptoms. Okay, so be careful. Now I'm going to show you the meaning. Focus. So important, what is important? Conveying is important, means one way, articulating two way, focus one way. So you are focusing, you are telling here, telling to the patient. You are telling the patient, but here you are focusing on associated illness outcomes. That's all. So here only you are the active person. Here also you are the active person. Here the patient is more active and you are taking more points from the patient. So now let us see the word, what the convey means. The word convey. Convey. Convey means what? Convey means to express a thought, feeling, or idea so that it is understood by the other people. So one way is a very special word, C1. C1 means if you can understand the meaning of this word, that means you are getting more than 400 to 450. If you are using C2 word, 450 to 500 marks you will get. This is a C1 word. He has used a very powerful word. Okay. He has used a very powerful word. That's it. So pass on, to express a thought, feeling, or idea so that it is understood. So information is passed on to the other person. Convey. Articulate. Now let us see what is the meaning of articulate. Okay. C1. Convey is C1. Write down somebody, C1 words. Somebody write down in your notebook, all of them, put them together and afterwards give to the others, give to me. So, okay, fine. Next one. So articulate. Articulate. Articulation. Articulate. Able to express thoughts and feelings easily and clearly are showing this quality. Able to express thoughts and feelings easily and clearly are showing this quality. An intelligent and highly articulate young woman. Okay, that means, so able to express thoughts and feelings easily and clearly are showing this quality. So a very specialized word. Okay, articulating means telling about the symptoms. Symptoms, the patients, they are telling about the symptoms and you are talking with the patient. Patient is important here. You are discussing with the patient. You are discussing with the patient. So patient is important and symptoms are important. So now let us see here. Then third point, avoid arguing with the patient. Okay. So non-judgmental approach. Okay. So articulation. The next one, symptoms. Okay. Patient's version of reality. He's telling his own version, what he feels like. Okay. What he feels like. Okay. What is going on in their world. Those are symptoms. Their world means patient's world. Their world means patient's world. Okay. So try to understand that one. So patient's version. Okay. So all these things are pointing here only. So patient's version of real. Patient is important. So everything is point. That is now from bullet point number 1. Whenever bullet points are there, they will be found everywhere. Okay. So you can find from here also. So you have to discuss with the patient what is happening to them and not your version. His version should be taken into consideration. Maybe you are a specialist doctor with 50 years of experience. That is, patient is important. You are not important. So that is the second version of explanation. Now let us take from the third paragraph. Let us take from the third paragraph. Avoid arguing with the patient. For example, by saying, of course, there aren't devils under the bed. It works better. I understand that this is how it appears to you, but this is how it appears to me. So, but, okay, I understand. Okay, empathizing with the patient, don't rule out. Okay, appears to you and appears to me. How it appears to you and me, the difference you are going to discuss. So the patient, what he's telling, how the symptoms appear to the patient and how the symptoms appear to me. Okay, so both. Try to understand that one. Don't argue with the patient. Okay, so it appears to what appears, the symptoms, signs and symptoms. Okay, appears. So whatever you feel is different, whatever the patient feels is different. So you have to discuss with them. Okay, as an individual, it appears to you like this because you're first time seeing, but I'm a doctor, so this appears to me like this. Maybe you are right also, but like that one, you have to negotiate, empathize with the patient. Patient is very important here. Okay, it is better to say. Say means articulate. Okay, saying means articulation. See, everywhere you can say. Arguing means also articulation. Avoid. Okay, arguing, talking. So discussing everything. But this is negative. Argument is negative. Okay, saying is positive. Right? Okay. So this is the way you can go for the third point. Then fourth point, you be true to the person as they were when well. Remember, hostility can be a symptom of the illness. Hostility also can be a symptom of the illness. Remember, important. Because remember, hostility can be a symptom of illness. Remember means important. That's why you have to remember. It will be another symptom. Okay. Right. Avoid diagnostic labels. Hostility means what? Being hostile. The patient is not ready to explain because it's a symptom of his illness. They will not tell. Hostile, friendly, hostile. Some people are friendly with you, some people are hostile with you. That means they're not ready to be friends with you. That is hostile, means rejecting you, staying away from you, blocking you. That is called hostile. Hostile means keeping away from somebody, blocking others. That is hostile. Not accepting you as their friend, being hostile, treating you like an enemy, or avoiding people like that one. That is hostile. Avoiding people is called hostile. Avoid diagnostic labels at too early a stage. Instead, focus on discussion. Discussion means articulation around the patient's symptoms and experiences. Experiences are also symptoms. Avoid using stigmatizing. Avoid using stigmatizing language. Language is articulation, talking, saying. For example, some patients prefer a person who experiences schizophrenia rather than schizophrenic. Okay, a person who experiences schizophrenia rather than schizophrenic. So don't label. If you say you are mental, he'll get angry. So if you say you are mental, then he'll get definitely angry. If you say your behavior is not normal, okay, it's not normal. But if you say mental people do like what you are doing, then they'll get angry. So stigmatizing language, labeling them as mental people like that one. Okay, so don't use such labels. Okay, so you cannot say you are a careless person. So you have to be careful. You can say you are careless. That's okay. You are he's a careless fellow. You are a careless fellow. That means it's not wrong. You are careless means person is not careless person, but he was careless in particular situation like that. So don't use don't labels. Okay, so instead of that one, you can be positive. You have to be careful like that. You can say same thing. You are careless means you have to be careful. It's one and the same thing, but how you are using the words is very important. They may be friendly with you or they may be hostile with you. If you say somebody, you are a careless fellow, that means he'll be angry with you. He will be hostile with you. Next time he'll not share anything with you. But if you say you have to be careful, then even if you are enemy, he will like you. If you say you are a careless fellow, even if you are friend, he will start, hating you. or disliking you. A friend who uses negative words, okay, he will get hostile response. An enemy who is using positive words, he'll get good response. So remember that. Okay. People like good enemies and people hate bad friends. So try to remember that, what I'm telling you. So answer is everywhere in all the points. So such points will be everywhere, bullet points. Okay. Will be everywhere. Everywhere symptoms are there. Everywhere symptoms are there. Appear means symptoms. Okay. Suspected because of symptoms. Symptoms. Everywhere symptoms is there, the word. So that is how to enter screen. Yeah. Already 2 o'clock. Oh my God. Yes. Now, 2 more questions are there. So clear all drawings. 2 more questions are there. So shall we move forward with 2 more questions? Okay, shall we move forward with 2 more questions and finish them? Part B, all the 6 questions. Even if 2 people are ready also, I'm there. Okay. Just give me your response, yes or no. Shall we move forward, yes or no? Ten, 9, 8, 7, 6, 5, 4, 1 person said yes. 3, 2, Jansi said yes. Okay, I told 2 persons. Yeah, Shahid and Jansi said yes. Okay, the others don't want. Okay, then you can carry on with your other work. Okay, so I am continuing. Right, that's it. You people cannot say one yes or no. Someone is asking you. Please do that thing. Okay, fine. Very good. Thank you. So we are moving forward. There are some people who are working, so they cannot respond immediately. Those are different. But those who are regular, they can answer. No? Why is this? Let me know who is serious for reading. I am interested. Yeah. Who is Shahid Neha? Shahid also said to me. He sent direct message. Okay, 3 people. Jansi, Neha, and Shahid. Okay, very good. So fine. It's okay. No problem. No problem. Okay. I'm not going to give any chocolates to anybody. Okay. I'm going to give only questions, answers. That's all. Come on. So we are moving to the next one. Yeah. 2,338. Very good. Strength is growing. Fine. 5th question. So 2 minutes. Yeah, 2 minutes. 2 more questions are there. We'll finish and then afterwards we'll have lunch. Shahid Latif, I have exam on 22nd October. Okay. I'll get back to you afterwards. Yes, last 30 seconds. Yeah, we have got the answers. Okay, how many? 1, 2, 3 only still. Okay, fine. Right, now let us see here. Let us check the answer. So what did you give? A, B. Okay. A, B. It's A. A is the right answer. Okay. A is the right answer. Okay. Right. So question number 5. Question number 5. Okay. So the answer number 5 is A. Right. The answer number 5 is A. Okay. Next. So now let us discuss. 2 people have given A as the answer. Who are they? Shahid and Jano. Okay. Yes, Shahid. Okay. So, yeah, Shahid, you can unmute.
Yes, sir. I will speak quickly because I'm on duty now. Actually,
Okay,
the
fine.
answer
No problem.
answer
Carry
is
on.
in the first answer is in the first line in the contrast paragraph. However, it may be permissible and appropriate to share the information with other organizations so that there may be a reasonable to use it. So here is the answer. The complication is in the paragraph where is written 1. Under common law, any sharing of information must not identify any individual unless there is a legal means. So these 2 answers, B and C, are in this paragraph, but overall the answer, the statutory catalog informs this is in the first line of the paragraph.
Okay, fine, that's fine. Okay, there are circumstances where, yeah, Neha. So not Neha, what is her name? Jansi. Jansi.
Sir, here answer is here, sir. However, it may be permissible and appropriate to share the information with other organizations, so they may make reasonable use of it. And the answer is stating appropriate dispensation of information is legal. Here it is given that may be permissible and appropriate to share the information. So appropriate dispensation of information is okay. And in the first point they have given, under common law, any restricted sharing of information must not identify any individual unless, here given unless is the word, sir, there is a legal means. So unless there is a legal means, we are not supposed to share the information. And other 2 options are completely contradicting from the given.
Okay. So appropriate. Sharing the information means dispensation. Okay. Dispensation. Share means dispensation. Information. Okay. Right. Permissible. Okay. There are circumstances where it is not permissible. Okay. There are circumstances where it is not permissible to make information publicly available. However, it may be permissible. Legal. Okay. Legal. Appropriate. Permissible and appropriate. Okay. That's what it is. So permissible means legal. Permission. Okay. Legal permission. Official. Okay. So now catalog. The statutory catalog informs. Okay. Statutory catalog informs. Okay. Now let us see here. Right. Permissible. Under common law. So legal. Any restricted sharing. Sharing means dispensation. Sharing of information must not identify any individual unless there is legal means and purpose. Purpose means appropriate, reasonable, purposeful, reasonable, purpose, appropriate, reasonable. Okay, to do so. Permissible, legal means will include cases when that person, okay, this is fine, different things. Okay, right? So these are various reasons. So everywhere the point is telling here only. Okay, legal. The person that the information is about has consented. This is one condition. So if the consent is there, it becomes legal. There is a statutory base for disclosure on court order. Statute is here. Statute means legal. Basis. Okay. Catalog. Okay. Court order means legal. Okay. Court order means legal. Okay. Public interest justification for this. Justice means legal. Okay. Public interest justification. Otherwise, it will harm the people. So public interest justification. There is a proper reason. Okay, to support. If it goes to the court also, it is right. The court should say that. I like that one. Or there is another basis in law. If there is another basis, another catalog, another rule, another, so that is in law. Okay, another article or another one in law. Law means legal. So everything is pointing out there only. Okay. Only under this, it's conditional. It's conditional. Okay. Right. So that is how. So consent of the individual must be maintained. That's only one point. There are many other. This is only one. Consent of the individual is only A. Then what about B, C, D? Okay. Right. Next one, judicious consideration is required for data sharing. So it is not a judicious consideration. It should be supported by law also. No, not only judicious means according to your mind. Okay. According to your mind, you decide something. No, that is judicious. It's not according to your mind. It should have legal sanction. What you say right is not always right. For you, you may see it okay, but everywhere it's not okay. So it should be legal sanction. So only, yeah, judicious, it's right. Judicious is right, but it's not everything. Okay. All right. Afterwards, when it goes to the court of law, or anybody says, yes, you are right, everybody should support like that. That's the point. Yeah. Next, the last question. Yeah, last question. Print screen. Yeah, last question. 2 minutes. Yes. So we have got the answers. This is for question. Is this for question number 6? Okay, yeah. 27, 232, 234, yeah, fine. So let us check the answer now. Answer is C. C is the right answer. So Shahid and Neha got the right answer. Okay. C is the right answer. Okay. Yes. So now let us discuss this question. Yes, Shahid and Neha both got the right answer. So let them explain. Shahid. So if you are comfortable, you can explain. Otherwise, if you are working or something, leave it. Neha.
Yes, sir.
Yeah, can you explain the reason why you said this answer?
Sir,
Answer
in
is
the
C.
yes, sir.
Okay. Why do you think C is the right answer?
Use informed choices for later care. So in the second bullet points, choosing a person you want to make decisions for you if you are unable to do for yourself. So this person is called a healthcare agent. This is one thing I have seen. And in third bullet point, talking with your doctors and loved ones, sir. This is second thing which I have seen. And third, my care, here it has given writing down your healthcare goals in my care. So by seeing these three choices, I have selected the C option.
Yeah, that's fine. So advanced care means later care. Okay. Planning in advance, care planning in advance. Okay. Now here, the health guide advises. Okay, question only, answer is wrong. Advises, not CES. Okay, advises, ADVISES. Maybe the typist has done a mistake or the person who has written this test has done a mistake. The healthcare advises, SES. Mistakes happen, that's okay. Okay, the health guide advises individuals to do what? Prepare for long-term wellness plan. Long-term. Okay, advice or recommendation. This is a different type of question. So the health guide advises. What is the advice? What is the advice? Prepare for long-term wellness plan. Long-term is important. Wellness means care. Prepare for care plan. Okay, long-term is the most important word in this part. Then entrust a confidant for further case. Confidant, that a person whom you trust. Okay, entrust a confidant for future care, whom you believe. You have to give that responsibility to somebody whom you believe. Confident, on whom you are confident on. Use informed choices for later care. Informed choices for later care. So here, if you see these three things, okay, if you see these three things, so long term, is there anything called a long term care plan? Prepare for long-term wellness plan. Is there anything long-term? Okay, just let us see here. Number one, entrust a confident. Okay, the person is called the healthcare agent, so he is the confident. You trust in him. Agent, you trust in the agent. A person whom you want to make decisions, a person or an agent. Okay, so choosing means selecting and giving him the responsibility. Okay, you choosing a person you want to make decisions for. If you are unable to do it, if is the condition. The condition is if you are unable. So this is not always necessary. This is a conditional. Okay, this is a conditional. Confident is not necessary if you are okay. Only if you are unable to do it. If this condition, then this is okay. If you are able to do so for yourself, no need. If you are able, then no need this one. So try to understand. This is depends on condition. What condition? If you are unable. If you are unable. This interesting, a confident. Entrusting the responsibility. So this entrusting the responsibility. Okay. Only if you are unable under this condition. If you are able, then you don't need this one. Okay. If is the condition, only in these conditions. There are two options. You are able or you are unable. Okay. Only if you are unable, you can do this. If you are able, why? If you can do your decisions on your own, then no need of anybody. Nah? So this is only 50% right. This is 50% wrong. So this is not always. Only under, this is a conditional point. The next one. Okay. Next one. So long term. So there is nothing called long term anywhere. Okay. Long term wellness plan. There is nothing called long term wellness plan. Okay. There's nothing like that. Use informed choices. Used informed choices for later care. So you have some choices. They will give you different things, and which are the best. Okay, you will take. So you write down your health core goals in my care, an advanced directive. Advance now for later care. Advance. Now you are doing this one in advance. Advance. Okay. Directive. You are giving suggestions for later. Directives. You are directing. That means you are telling about your choices. What should be done, what should not be done. You are giving some directions. That is directive. Okay. So this form, you are filling it up. Write down your healthcare goals in my care and advanced directive. These forms guide your healthcare providers as to what type of healthcare you want. It also helps your loved ones understand your wishes in case they have to make healthcare decisions for you. In future, if you write down, if afterwards in future, if you cannot, then these points can help you definitely. So, because this is the information, because you are writing down the healthcare goals, this information, whoever reads this one, they will use this one. And in the future, you can also use, because you know what you want to do. Advance, you are doing like this one. So when you mention all these things, that will be useful for you. Advanced directive means telling in advance now for later care. Informing in advance. So now you are booking. Advance booking means later you will watch the movie, like that one. Advance booking for movies. That means you are booking in advance. but you are not watching the movie now. You are watching later. Okay, later watching the movie. So now you are booking in advance. Maybe after 1 week or after 10 days, you are advance booking. Okay. Next one. So this is how it will go. So advanced care planning. Advanced care planning is for later stage only. Okay. Advanced care planning is for later stage only. So now let us see here. Points, choices. Writing down your health core goals. Goals or choices. Goals or choices. And you have written down. That means you are giving information. You are giving information. You are giving information. And it also helps your love. Okay. Later care, advanced directives. So you're suggesting them to take in these directions in the later stage and do it. Okay. It also helps you. Okay, fine. Take care of decisions for you in the future if necessary. That is what it goes. So you're using in the future. It also helps you understand and use. Your wishes means choices. Okay. Informed means you are writing down. So that is informed. So this is how you take the points from here. Okay. All right. This is only if you are not able to do on your own. That is it. Okay. Right. So this is how you will give the points. Height, floating, making controls. So this is how it goes. So we'll meet later. So we'll see part C afterwards.